Really sad story. We hear about drowning, but we saw a case of it in the news recently.
Yes.
And we just want to alert parents as to dangers of what to look out for because we're in pool season now.
Yeah, that was such a sad story. And we all have little kids or around little kids. The most important thing to know is that it can happen with a very little bit of water. The three most common things are really either the child swallows water, they're dunked in, sometimes kids like to play around and they get dunked underwater, or they've actually had a serious event where they're struggling and they went underwater or caught a wave or something like that, as was the case of this young boy.
But I mean, now, kids go in the pool, they swallow water, so what do we do
Exactly.
here?
I do want to stress, Allison, that this is rare, but when it does happen, it can have fatal outcomes. That's the reason that it's always coming up. Now, the main symptoms to look out for are continuous coughing after the event or getting out of the water, flared nostrils, trouble breathing. Your child might seem sleepier than normal, but not after what's common, a typical day at the pool. They get tired. No, their appetite will go down. They just want to sleep. Their breathing might seem more shallow, and they can have nausea and vomiting simply because there's pressure in the lungs. What I also wanted to mention, Allison, is that there's really two different things that we're looking for here. There's dry drowning, which happens right away. That's when water gets into the mouth, but not into the lungs. It's just the vocal cords, they spasm, and then it cuts off the airway, and so you see signs from that right away, very quickly after getting out of the water. But the secondary drowning is really the scary one as well, because that can happen up to a week later, and in that, water gets into the lungs and it creates what's called pulmonary edema. It just starts filling the lungs. It's making it so that your body doesn't oxygenate as well, and that's why, for example, in this boy's case, he became more sleepy, he was vomiting, he suddenly complained of pain, but at that point it was too late. So the main thing to urge parents is that if you're continuing to see your kid cough, you're worried at all, take them to the emergency room or an urgent care, not to your pediatrician's office, because they will need a chest x-ray, they may need IV fluids and oxygen, things that you might not be able to get right away at your doctor's office.
So there is a way to treat a person in the meantime if you do spot the warning symptoms, warning signs.
They can get diagnosed, they can get supportive care, extra oxygen to pull them through that and get that fluid out of their lungs. But you need that medical attention.
Right, and it's a hard topic to talk about, but you need to talk about it so you can look for the warning signs. Shilpi, thank you very much.